Hepatitis. We're going to discuss about hepatitis risk factors, signs and symptoms, the types of hepatitis, and the treatment. Hepatitis is the inflammation of the liver. Risk factors: specific hepatitis viruses, in which it can be contaminated by means of drinking contaminated water or through sexual contact with a person with a certain type of the virus. Alcohol hepatitis can be developed when the alcohol damages the liver. The chemicals in alcohol can trigger inflammation that destroys the liver cells. Over time, scars replace healthy liver tissues that interferes with liver functions. Drugs can be transmitted when using IVs that has been used by someone with hepatitis. Autoimmune happens when the immune system mistakenly attacks the liver cells. Signs and symptoms: jaundice, the yellowing color of the skin or whites of the eyes. You will experience fatigue, weakness. You will experience pain and discomfort in the abdominal area, in the joint and muscles, loss of appetite, nausea and vomiting, diarrhea, bowel movements, light or clay colored. Urine is dark. Fever, chills, headache, itching, weight loss, skin rash. Types of hepatitis and their comparison: hepatitis A, B, C, D, and E. For hepatitis A, the transmission is oral or fecal. It's acute only, which means that your body or immune system will fight off the infection. However, hepatitis A can be contagious 2 weeks before the signs and symptoms presented, or 1 to 3 weeks after the signs and symptoms presented. Signs and symptoms is the typical signs and symptoms of hepatitis. Prevention of vaccine can be taken within 2 weeks of exposure. Now, hepatitis B, transmission is bloodborne or body fluids. So it's acute. It can be acute and can be chronic. Chronic means it lasts for more than 6 months. The signs and symptoms, typical signs and symptoms of hepatitis: prevention, vaccine can be taken within 24 hours of exposure. So unlike the hepatitis A, hepatitis B needs to be prevented within 24 hours. Hepatitis C, same with hepatitis B, it's bloodborne and body fluid transmission. It can be acute and chronic. Signs and symptoms is the same, typical. Prevention, no vaccine available yet as of the moment. Hepatitis D is the same with B and C, can be transmitted through blood or body fluids, can be acute and chronic. However, this only occurs in people with HBV, like hepatitis B virus. So if you have the hepatitis B, you can only acquire the hepatitis D. Vaccine or prevention, no vaccine yet. However, those who don't have the hepatitis B yet, you can have the vaccine for hepatitis B in order to just take the hepatitis B first. Because as what we said, this can be acquired only for those who already have the hepatitis B. Hepatitis E is the same with hepatitis A. Can be transmitted through oral or fecal. It's acute only. The signs and symptoms is mild. Prevention, currently there is no vaccine in the US, but can be prevented through hand hygiene and drinking pure water. And hepatitis E can be it is a self-limiting disease, so hospitalization is generally not required. So those are the comparisons of the types of hepatitis. Next, we're going to discuss about the hepatitis treatment. Initiate bleeding precautions per facility protocol. No straight razors. Use soft toothbrush and good oral hygiene. Use stool softeners to avoid straining with bowel movements. Monitor fluid and electrolyte balance. Monitor input and output daily weights. Assess skin turgor. Administer skin medications appropriately and monitor for effectiveness and adverse reactions. Monitor lab values prior to administrations. Provide and monitor supplemental feedings and TPN as necessary. Nutrition and lifestyle education, prevention and protection. Avoid alcohol and illicit drugs. Avoid exposure to dirty needles. Avoid contact to bodily fluids such as semen, blood, stool, and vomit. Encourage vaccines for high-risk patients and their families.